I'll share my screen shortly so that we can look at what the agenda is. Yes, so we'll be, of course, we'll have the welcome and opening remarks. I'll introduce the speakers and myself, which is the host, which I have already done. We'll have the first session where we'll talk about breast cancer. We'll talk about the risk factors, detection, the screening guidelines. Then we'll listen to a personal story by one of us who has survived breast cancer. We will have a break in the lessons so that we can take questions and answers from the first session. We will continue with the third session, which will be about diagnosis, the treatment options, the coping strategies. We'll go on to talk about how you can access medical care here in Canada, the role of family and friends, and how to provide emotional and psychological support. We will have a break where we'll also take questions and answers, and we'll talk about the lifestyle choices and resources for survivorship after breast cancer, and then we will close. So, stop my sharing. Sorry. So without much ado, I'd like to begin by saying you should just send using the chat feature, type in where you're joining us from today, where you're joining us from today in the chat box. I know that Adetoro is joining us from Lagos, Nigeria. We might have other people from different places, considering the diversity of our participants. Some people might be in Cambridge, some people are Kitchener, some people Waterloo, some other people somewhere else in Canada. So just using the chat feature, would like to know where you're from. Just kindly send us a message saying where you're from, where you are joining us from. Okay. So I'm saying Kitchener. We're glad to have you here. Thank you so much for joining us. Lagos, Nigeria. There's Moji Bola from Lagos, Nigeria. I'm joining you from Cambridge, Ontario. Yes, there's Kitchener, Bossede from Kitchener, Ifeyinwa Kitchener, our host, our guest speaker, Busola from Kitchener, Adewale from Kitchener. Thank you so much for joining in. Yes, thank you so much for responding also. So let's talk about breast cancer. Why is breast cancer so important? It's one of the most common cancers among women. And I also got to learn that men are also affected by breast cancer. So it's crucial to spread awareness to ensure that it's detected early and people have access to treatment and support while they go through this journey. So without much ado, I will introduce our speakers so that we can go on with talking about breast cancer. So the first speaker is Dr. Tola Iyetunde. She was born in Lagos, Nigeria, where she obtained her primary and secondary education and a first degree in nursing from Ladoke Akintola University of Technology. She's also obtained her master's in nursing science from Thailand and a doctorate degree from the Chinese University of Hong Kong. And both her master's and her doctoral degree were fully funded by the government of Thailand and Hong Kong, respectively. She was awarded the Outstanding Academic Award from the School of Nursing, Chinese University of Hong Kong. And she's also a researcher focused mainly on adult and geriatric nursing, especially cancer survivorship, pain management, maternal health, and dementia care. She has published her research works in internationally referred journals and presented at several international conferences. So we'll be she's currently a postdoctoral fellow at the University of Waterloo, Ontario. She's a registered nurse with the College of Registered Nurses, Alberta, and the Nursing and Midwifery Council of Nigeria. She's a member of the Canadian Black Nurses Alliance and volunteers as the Director of Research and Statistics at the Institute of Nursing Research, Nigeria. The second speaker is Mrs. Olubusola Adegbenjo. Please forgive me for murdering your name if I didn't get it right. I'm still trying. She's a Canadian registered nurse with the College of Nurses, Ontario, CNO, and CRNM, which is the Regulatory College for Nurses in Manitoba. She has worked here in Canada as a nurse team leader and with different organizations. She's also worked as a registered nurse with Grand River Hospital, Kitchener. She has previous years of experience in a Nigerian teaching hospital as a trained registered nurse, midwife, and public health nurse. Presently, she runs Modelto Health Services as a BLS and first aid instructor, certified by the Heart and Stroke Foundation, Canada, and Red Cross. Modelto Health Services also provides basic nursing care. Our third speaker today is our survivor. We also call her our warrior. She's a resilient Canada survivor. Omowumi Ewebiyi is a resilient cancer survivor who has overcome adversity. She's filled with strength and determination. Her journey is a testament to the power of hope and the importance of early detection. Today, she inspires others with her story of survival and resistance. A determined woman with a supportive husband, 2 beautiful children, and supportive family and friends by her side. She faced adversity with an unwavering determination and love, guided by her unwavering faith in God. Armed with her deep belief that with faith, anything is impossible, today she's going to inspire us with stories of survival and resistance. Her goal right now is to educate other women about breast cancer, the prevention, the regular checks, and support for this disease. So without much ado, we'll call on Dr. Tola, who will start today with the first session. Over to you, Dr. Tola.
Thank you very much, Ivy. It's a pleasure to be here. Thank you, everyone, for joining this meeting. I'll share my screen. So today we'll be talking about breast cancer, and we have a lot to talk about, and I'd like to say a very big thank you to Mrs. Testimony Adegbenjo for preparing this slide together with me. And thank you to Ivy for the support as well. So these are the things we'll be talking about today: the overview of breast cancer. We'll be talking about diagnosis and treatment, support and resources in Canada, and survivorship. So just as a background information, this is how the breast of a woman looks like in drawing. Well, it comes in different shapes and colors, but we have structures lying underneath what we can see physically, and that's we have the chest muscles, our ribs, and we have the milk duct, the fat, and the lobules. But I don't want to go into serious details about this, but as you can see, there is something different about this breast, and that is the tumor that you can see here. So we'll be talking. So when you talk about cancer, it's a tumor, and it's a tumor that because it's something that is not supposed to be there, that is growing there, and sometimes people detect that the tumor may be cancerous or not, or benign. So, but here today we are talking about cancer, so it's the cancerous one we are talking about. And this cancer affects millions of women every year around the globe. And it's a leading cause of death, especially when it comes to cancer. It's one of the leading causes. It affects 2 million. There are 2 million new cases globally, especially in 2020. But it's so interesting that the focus has been on women. However, there is a sizable portion of men that this cancer also affects. So I would say that in my own general definition, I would say that breast cancer affects everyone that has breasts. So it can be a man, it can be a woman, it can be whatever gender identity you identify as long as you have breasts, whether it is matured or not, in terms of the size and things like that. So how are Canadians affected? So the numbers showed that 28,600 Canadians by 2022. So this data was a projection from 2018 that as at last year, about 28,000 Canadian women will be diagnosed and 5,500 will die from breast cancer. And every day, on the average, 78 Canadian women are diagnosed. So you might be saying that, oh, I'm not Canadian, but anyway, you are in Canada, so this information should be helpful. And on the average, 15 Canadian women will die from breast cancer every day. So that's a lot so it means 15 families will lose their women or their mother, their sister, or their sibling, and 270 Canadian men will be diagnosed. So this is a projection from 2018. So you see the wheel, because I don't want to change the terms because it's a projection. And if 270 men were diagnosed in 2020 and 55 will die from breast cancer, how many of this will be Black or Nigerians? This is a question that we don't have answers to because there is very limited data about the incidence of breast cancer among Nigerians. But this is what we found in terms of the data about Africans in general. So as of 2018, there was over 168,000 cases. And by 2040, it will double or triple. And here in West Africa, you have a 99.1% increase in terms of the numbers of cases. And as a Nigerian, this is the projection that 50,000 new cases will be diagnosed by 2040. That is a lot. Well, you might say that we have 220 million people in Nigeria, but when you consider the development of Nigeria with this incidence, then it's a lot. Okay, so what causes breast cancer? There are some causes, or there are some risk factors that you can change. There are some that cannot be changed. Part of the ones that you cannot change is the family history. If, say, a grandmother has breast cancer, or a mother in the family has breast cancer, there is likelihood that some of the children will have breast cancer. So this is a probability, and you can see the way the image has a cross, just like we do for other types of diseases that are genetically motivated. So there is a possibility. So if the person has 4 children, there's a possibility that 2 of them will have breast cancer. And as people age, the more they age, the higher the chances of getting breast cancer as well. Another thing is hormonal contraceptives. So if as a woman, you're using pills that contain hormone for childbirth prevention, then there is a chances that hormone responsible, actually the target hormone is estrogen. So with that hormone in your body and still adding more, there is a likelihood of breast cancer. Stress is another culprit here for breast cancer. So, and smoking, alcohol consumption, obesity, excessive weight, okay, and inadequate physical activity. We call it sedentary lifestyle, where you eat, you watch TV, you eat, you watch TV, no exercise at all. Then you can't modify this one. Early menstruation, you can't modify it. And depression is also another cause of another risk factor. So I won't say causes, because when you say causes, it means that it's definite. So it's a risk for breast cancer. Anxiety also is another risk factor. Radiation, so exposure to radiation. You would notice that most of the time when you go for an X-ray, they would ask you to put on a vest and put you in a room, and then the person who is taking the image will have to leave the room. That is to limit their own exposure to the X-ray. And you're not supposed to take X-ray like you're taking photographs. So like how often you take photographs like that. So what we are trying to do is limit the amount of times you are exposed to radiation because of the risk for breast cancer or cancer in general. And late age pregnancy or not being pregnant before is also a risk factor for breast cancer. Okay, having talked about the risk factors for breast cancer, what can you do to prevent breast cancer? So, like I said before, there are some things you can't change. You can't stop yourself from aging, and you can't change your gene. So, and you can't change when you started menstruating. So these are some of the things that you can't change. However, the things that you can change for yourself, you can always exercise, you can eat healthy, you can reduce or manage your stress, you quit smoking, you can stop alcohol, sorry, that should be alcohol. You should maintain a healthy weight. So there is a way to calculate your weight through your BMI, body mass index. That's your weight divided by the square of your height will give you your body mass index. And a body mass index of over 20, 25, I think, will be considered overweight. And then adequate sleep and breastfeeding can help. So you need to sleep properly. I think it's the Nigerian context that you are sleeping away your life, but in the real sense of it, you're also sleeping to health as well. Well, we know that the moderation is key to everything, right? So you also need to manage your health. Take care. If you're hypertensive, watch out, take care. Always take your medications properly. If you're diabetic, watch out and take care. Just your general health is very, very important, as these are linked, all this linked to how healthy you can be in general and how functional you can be as well. And you also need to limit your exposure to radiation. So you would see that the prevention strategies are linked to the ways you can reduce the risk factors that may lead to breast cancer. Okay, so I think 10 minutes, I'm not sure if I'm over 10 minutes, but if you have questions so far, let's talk about this. Questions? We have anyone with questions from what we've discussed so far?
Okay, thank you for that very interesting discussion on the risk factors. I'm a little curious about the stress, the risk factor under stress. How do we manage that? Because as Nigerian women, it's almost as if we're auto-tuned to work till we faint. You know, it's almost unavoidable. You are the alpha and omega with your family. You know, you're working, you're doing a business, you're taking care of the children. In fact, your husband is your number one baby. How do you, for me, I mean, I'm still struggling with how to hands off. So my husband will be like, leave it, I will do it. But my eyes cannot just leave the fact that that bottle or that cup is standing where it's not supposed to be. How do we detach ourselves from stress? Because it's almost as if every Nigerian woman is born and then given huge plaque of stress. Sufferhead, permits me, to use that term. But I'm sure my fellow ladies understand what I'm saying, that we just come with the whole package wanting to do everything. How do we distress? How do we detach ourselves from too much work?
Okay, thank you very much for that. Mrs. Adegbenjo, will you do justice to that?
Yeah,
Okay,
thank
I
you.
also, sorry to cut you. I also noticed people are typing in questions in the chat, so you can check that out.
Okay, okay.
Thank you very much. Thank you for that question. And I believe that every one of us in the house, we really understand that. But to be sincere, it's like when you're saying the physician heal thyself, we women, we carry so much burden. We have a lot. Well, we cannot overemphasize that. And that's why we have been coming down with a lot of sickness, a lot of health issues. And most time we don't even take care of ourselves in the process of trying to say we want to. In fact, we'll be having pain and we'll still be cooking, we'll still be, trying to do a lot of things. We need to consciously working on getting distressed, like trying to overlook things. I know most of the time we just want to get it done, get it done, get it done. If we know, at least it's a risk factor. We are not saying that, when you get stressed, automatically you are going to have cancer. It's just a risk factor, because by the time you begin to, a lot of things will be building up while you're getting stressed. So even apart from getting risk of getting cancer, there are other diseases also. But because you know that there is a need for us to consciously work on our work. One, can we try as much as possible to overlook some work? Maybe you see something on the floor. Maybe our husband comes home, drop their shirt on the chair, drop their shoe on the table, scatter. We understand that kind of a thing. Sometimes, oh, why are you doing this? Why are you doing that? By the time you are even shouting, you're already getting stressed. If it is something you can do, do it. If you cannot do it, overlook it. If you know that you're just coming from work, you're tired, please just go. Go to the room, shower, relax. Try to get something. What do you like to watch? Is it to watch movie, to just relax? Create that time for yourself. We have this only one life. I understand that it's difficult, but now is a thing that we need to be conscious about, even in working it, because there are a lot to this stress management. I hope I've been able to answer our question. It's a conscious effort. We just have to do it. Like try to, and for you that you're in Canada, you don't have maid, you don't have housemaid, you don't have father, mother-in-law, or niece, or somebody that is living with you. So because of that, you just have to, do what you can do and leave the rest. I think that's what I can do I can say for now about the stress, because what it can cause is even more than even the risk of breast cancer. Thank you.
Okay, thank you very much, Ma. You did justice to that. So it takes intentionality to reduce stress, and if you can get help, get help. If you can afford to pay for help in Canada, there's nothing stopping you. If you can afford it, you can afford to pay for someone to clean your house once every month, do it. If you can't afford it, then clean it when you can, not every time. So just as much as possible, be intentional. And another question that I have here says that my mother had breast cancer. What's the best way to know how to the statistics? So we'll talk about diagnosis and detection later, but I would say that just look at all the risk factors that we've talked about and all the strategies that we've talked about. What can you do intentionally from this to reduce your risk of getting breast cancer? You may not be able to modify the genetics that you have because of the risk there, but at the same time, you need to also be conscious about all the efforts. And also someone asked that, can garlic and ginger reduce the risk of breast cancer? Well, I would say that in general, dietary modification is very important. Your diet, what you eat. they are plant-based food, but drinking it, there has not been research to solidify that taking those two alone can help reduce the risk. So I'll just say that eat healthy. That's the best thing you can do for yourself. Another question. Okay, someone said that, yes, because of antioxidant, yes. Nurse Adebenjo said because of antioxidant, yes, they have antioxidants. So also other types of fruits and vegetables as well have antioxidants. So it's not limited alone to ginger and garlic. That's why we say that eat healthy, plant-based diet, less of processed food can help a lot. Okay, I think this will be the last question because we have 5 minutes for the question, right? What is the effect of ductal carcinoma in situ? Can it be called early stage of cancer? This is book question. This is book question. So just like the name, I showed you the picture of the breast the other time, right? There is the milk duct, and carcinoma is cancer. So in situ means that the cancer is in the milk duct. So it is localized in the milk duct. Well, as for the stages will depend on so many things that the doctor or the oncologist will have to factor in: the location, the size of the cancer, whether it has spread to other parts of the body and things like that. So it could be early stage, it could be mid stage, or it could just be a benign tumor. So it could be anything. So I wouldn't want to say that outrightly it is early stage. So it depends on a lot of factors to determine the stage that breast cancer is. Okay, so I think we have spent 5 minutes. More questions are still coming in, but over to you, Ivy.
Oh yeah, so some of these questions we'll still get to answer in the later stages of the session. So I guess we'll just go ahead with your session. I will be hearing from the next speaker, Mrs. Ewebi. She will tell us about her story. I hope I did not murder the name. Please forgive me. I'm trying to pronounce it as it is spelled. Okay. Thank you. So over to you. You're muted.
Hello, everyone. Good evening. My name is Amon Webi. I am very happy to be here. It's a passion for me now to share my story so that I can inspire, even if it's just one person, to either prevent, to manage, or to overcome. The prayer is that God will continue to use me to show others that this breast cancer mountain can be moved. I was diagnosed in March 2022, and it was stage 3 because it had spread to a significant part of my body. But, I think God just wanted to make sure that I caught it on time, because I mean the normal Nigerian woman, if you are not feeling well but you can still carry your leg, you will still go to work and you will still do everything that you need to do. The only time that you remember that there's a hospital is when you have broken down, and that used to be my case. I mean, if I had a headache and I could still move, I will still move. My friends will tell you that they don't know the kind of energy that I have, because I can go to 7 places in one day and still come back and still do what I need to do at home. And it didn't matter then. It's just now that I'm learning to slow down, and it's even very hard. It's strange to me because I'm not someone who slows down, but I am very intentional about it because I have seen death, and I overcame it by God's grace, and I don't want to walk down that road anymore. So I'm very intentional about everything that I do now. But I was diagnosed in March, and thank God that I had someone beside me on the day that I was told, because it was shocking to me. Breast cancer from where? Nobody in my family has it. Even when I went back to go and ask, oh yeah, nobody had it. So it wasn't genetic. And so it was strange to me. But here I was with breast cancer, and I was told I was going to treat it. And I had to treat it very quickly because it could spread. Nobody knows how to control it. And so that means treatment had to go, you know. Initially, there was, oh, don't do that. Chemotherapy will kill you. This will do that. This will do that. And I remember that I was the daughter of a king. And I went down on my knees to my king and I said, dear God, this is what I'm going to do. I'm going to go to the doctor and I'm going to get treated. Your business is to take care of me. Every stage of that treatment must do what it is supposed to do and nothing else. My body must not be destroyed. I must not be disfigured. I must not look like someone that people will be running away from. You must keep me in sound mind. And to be honest, God did even more than what I asked for. For every time that I went for the treatment, yes, I had a timeout. I'll probably be down for like a week. There were times when it was 2 weeks after chemotherapy, I'm still in bed. But the truth is, there was a fighting spirit inside of me that was not going to, let myself go. There are times, and then I was working. I was a general manager in a dental clinic, and my employers were not going to let me go. They gave me a reason to fight. So I'll have to go to work. I still have to tend to, work duties, and, nobody was treating me like something was wrong. So it was helping me fight. So no matter how many times chemotherapy knocked me down, once it was time to get up, I got up, I went out, went about my business, took care of my children, did what I needed to do. And, one beautiful thing, and I think I'm very happy that all of this happened in Nigeria before I moved. One beautiful thing that happened to me was I had a network of influence that was very supportive. I had people from my nursery, primary, secondary school, church, ex-colleagues who were going all out to help me. I can't say I did it by myself. It was a whole village. It was the whole village. There were people who were checking on me. There were people who were sending me funds. There were people who were coming to my house to help. There were people who were sending me meals. There were people who were taking turns to come and watch me or take care of me. I mean, it was a lot of support. I don't think I'd have gotten that kind of support from Canada because here is fast-paced and we all have bills to pay and there's really little time here. So I understand that. So that's what I'm saying. I'm saying that I'm glad that it happened back at home and I was able to, get that kind of support because it helps me to fight. I had to change my diet, not totally. What I must say is what I totally, removed from my diet were processed foods, processed meals, all of it out. But did I eat regular meals? Yes, I ate regular meals in moderation. And then I had a lot of vegetables. I was taking ewedu. I was taking soursop. I didn't really take a lot of soursop because at some point, I don't know whether it's true or not, but at some point when I was taking my chemo, it seemed to be conflicting. And so my oncologist said to please stop until I finish my chemo. When I finish my chemo, I can start. And that's what I did. So I don't know if this is true because, they say breast cancer is different for everyone. Treatment is different for everyone. So I don't want anyone to take my words, verbatim and say, this is what happens. No, this is my own story. So I stopped the soursop for a while until I had finished my chemotherapy. So what I was doing most of the time was taking ewedu very early in the morning. And then the way that I do my own ewedu is I will parboil it, blend it, and drink it just like that. Parboil, blend, and drink. So it's not the very cooked one. The very cooked one, yes, I would take with my amala or my eba or whatever it is I wanted to eat. And I used to do a lot of ugu because my blood level was very low. My immunity was very low. So I used to do a lot of ugu. I also used to take a lot of fish. The one that has scales, not necessarily Titus or catfish. It was the one that had scales that they said I should eat. So I could just, steam it very well with crayfish and a lot of onions and then just eat it. Everything to just build back because what I understand by chemotherapy is drugs that are put together to kill the cancerous cells. And because you cannot recognize the cancerous cells, it has to take away all the cells. So that means your body's depleting. And for that reason, you have to nourish it back. So whenever they gave me food and I threw up, I would say, go and cook the food again and I will eat it. I will keep eating until something stays in my tummy. It mattered so much that I had something inside of me that was building. In my head, I would literally imagine how chemotherapy was working in my body. And it used to help me to make sure that if it's oats I can eat, I will eat. If it's banana I can eat, I will eat. If it's pineapple, I did not stop eating. And you would never see me and say something is wrong with her. Maybe once in a while when I'm having my the chemo blackouts, you would find me very weak, or that, but you would not really find. I found a lot of things to do to keep me busy because I just didn't want, one of the things I didn't want to happen to me was, lose myself. My friends will tell you I'm a very energetic person. I wasn't going to go down without a fight. I'm the daughter of a king. It wasn't going to happen that I would just go like that. Like, yeah, they would not, nobody can hear that mommy would just leave life for cancer. No, the cancer was going to leave mommy. And that's it. That's the attitude that I still have till today. I decided that, okay, let's move so that I could get better health care because they had done stage 1. And you know how cancer is, you have to keep watching yourself for the rest of life because there is a small chance it can reoccur and you don't want that, So I decided, okay, let's move to a country where they're advanced in taking care of these things, that they're familiar with these things, and let's move. And that's why I'm here today. I did my surgery in August. And there were a few complications, but when God is involved in things, somehow he fixes things. There were a couple of things that were not properly done that eventually, by the time we did radiotherapy, some things got better. And by the time I got here, and by the time I finally saw an oncologist, things were put into perspective. And then there was another, treatment plan that has been put together for funding. Initially, my insurance could cover my tests in Lagos, Nigeria. But after a while, because cancer is such that you never know when it's going to end, you never know how much you're going to need to take care of yourself. It just doesn't stop. So I don't know, I'm not sure what the government is planning to do to that, but I find that a lot of people, are already dead when they hear that they have cancer because of the financial implications. That thing happened to me. I had a network. I mean, I brag all the time that the money that I don't have is people that I have. It's more than the money that I don't have. And that helped me a lot. I am not ashamed to say it. Many people came together to fix the Wunmi that we're all seeing now. It is everybody's testimony, it's not just mine. And I'm very grateful. And I say this to people, it is extremely important that at every point in time, you're checking yourself, whether you're doing the regular tests to be sure that there's nothing funny happening, or you wake up one morning and your body is just doing somehow. Just make sure that you go to the hospital. Please don't wait. Don't wait. Don't say, God forbid, it is not my portion. No, it's not anybody's portion. It's not Wunmi's portion too. But these things happen, and that's the truth. And so it's important that we do a regular check. We do a regular screen exercise. Go do your mammogram, do your breast scans. Just be sure that nothing is wrong, because you want to live that life. You want to fulfill purpose, and you want to do it in good health, because God is going to continue to bless us, and we should remain healthy to receive those blessings. We don't want to receive blessings when we're half-baked. So it's important that we do these tests. And please, I'm happy that a lot of my friends are here. Please listen to how to manage diagnosis or preventions and the risk factors. Thank you.
Thank you so much, Wunmi, for your testimony and your story. Very inspiring. You made if you have questions for Wunmi, we'll take them now very quickly so that we don't run out of time. I remember you also said, I'll just start pending when somebody else asks the question. You were talking about having to modify your diet. You had to do away with some processed foods. You didn't say what kinds of processed foods. So
okay, so for me,
it's kind of, it's quite ambiguous.
Okay, so for me, I used to do a lot of sodas, Coca-Cola, Fanta, Sprite. Coke was I don't eat normally. It's just to drink. Once I drink Coke, my energy is back. So I took out Coke totally and I replaced that with bananas. I find that bananas do the same thing that Coke does. It rejuvenates your energy. So I do banana. Then if I'm having sleeping issues, I do banana and cloves. I just boil it in small water and I drink it. Then I take soursop tea. Now, I don't do Titus in tins, all those foods that are in tins, corned beef, everything that is processed, corned beef, processed yogurt, things that have artificial sugar, sweeteners. I don't do them. You know, I've taken them totally out of my diet. So I do vegetables, I do regular meals that you cook on the gas cooker.
Yeah, like
organic from the farm, fresh
food
from the farms that you cook on your, not the ones that you microwave. I don't know if microwave causes cancer. I don't know that. But I cook my food from start to finish. Yes, I can warm my food sometimes if I'm hungry in the microwave, but I cook them fresh. I don't buy anything that's already frozen and then, I cook it fresh. I order from people who make fresh food, fresh meals. So
okay, thank you. Any more questions for Wunmi? If we don't have questions for Wunmi, we'll go ahead with Mrs. Adebenjo.
Yeah, thank you very much. Dr. Tola, have you finished? I think you have the next.
Okay, Dr. Tola, all right.
Yeah. Okay, thank you very much. So we'll still continue. I'll share my screen again. We'll be talking about diagnosis and treatment this time. So I try my best to talk about the diagnosis, the things you can do to check yourself first. So the first thing, most of the time, the woman is the one to detect first that she has something weird on her breast or in her breast, or the person with the breast is the one to detect first. Sometimes the men will also check and see, and we call this a breast self-examination. Most of the time, this is done by women monthly, and it's advised that women do this monthly because of their monthly period. And you do it once a month, a week after your period. You stand in front of the mirror or you lie down, whichever one is convenient for you, and you raise your arm. So you do it for both breasts. You raise your arm, you touch all portions, you check all portions in straight line motion, in circular motion, and you start feeling for lumps or for masses, and you check your underarm to, you feel, you have to apply pressure to your underarm to feel, yes, Wunmi is doing that, thank you so much. So you have to apply pressure to your underarm to see if there is anything weird, like there is a soft lump, a hard lump, or something. I don't know, the Yorubas, we call it koko. So if you have something like that, it's just weird. Normally, your breast should not have any hard lump or any lump at all. That's the ideal one. But if you start feeling something like that, then you should probably seek further help. And what would you see most of the time if someone is experiencing breast cancer? I've put up some pictures. You can see the circle here, the lump or a breast mass. Sometimes it's not always very obvious on the skin, like this one. And you can see indentation, like some part of the breast will just go in, dimple a little bit. Other times it would be changes in the nipples that people will have. Sometimes you see this change in skin texture, looks like an orange. You know how the skin of orange is, you see all the O's and all the pores, and you can also see the nipple is retracted here. That is, the nipple has just gone inside, very retracted. And you can see sometimes the woman has a discharge on the nipple. And this is something that most of the time, this is how it may look like. Not necessarily look like this. You can see this, there is lump and the breast is swollen here. You can see the lump. You can see how swollen the underarm is. And you can see that you can see how the breast tissue is like from the from the X-ray. You may not be able to understand this one, the X-ray image very well, but you can see different changes that can occur in the breast. The lymph nodes can be swollen, and you can see the shape and the size of the breast can change because of multiple lumps growing in different places. And other symptoms will be that the person will be fatigued, the person will maybe losing weight. Sometimes these symptoms are not even connected to the breast at all. And when I was doing research, and I had one of the participants of the research explain that she was having pain on her hip and her knee, and when she was telling her story, and she said that she had taken all the pain medication for arthritis. Her doctors, she went to see an orthopedic doctor, and the orthopedic doctor said, I'll send you for a breast scan. And that was it. So sometimes it could be bone pain. So, and like Wumi said, she said that whatever, don't wait until you're broken down. Whatever it is, seek the help of a healthcare provider. Don't start popping pain pills or painkillers. Don't start saying, oh, can somebody help me get a bony key and massage this part, it's swollen and things like that. Oh, I don't know what I hit. I think I hit my side, and that's why my side here is swollen. And then you start popping painkillers and then rubbing a bony key, using hot water, cold water, and things like that. Just seek help. It could come in form of anything. All right. So having said that, most of the time, after you've done your breast self-examination, you've seen the warning signs, you might want to go for a detection, like a confirmatory diagnosis. And most of the time you go for mammography. So it's just like an X-ray of the breast only. So they will do for both breasts. And you can see this X-ray here where they put cancer in this white lump. So they check the breast and see if there is any mass there or any tumor. Another thing that they do is ultrasound and biopsy. So yes, there is a tumor in the breast, but we can't tell whether this tumor is cancerous or not. Some people are lucky, it's just a tumor that is not cancerous, and they just need to remove the tumor and they are good to go. And some people are lucky, not so lucky. Once they take part of the tumor or remove the tumor and send it for further test, which is called the biopsy, the true biopsy, they discover that this is a cancer cell, and then the person has to undergo aggressive treatment. Okay, so this is another way to have a confirmatory diagnosis. So in summary, there is breast self-exam, there can be an ultrasound, there can be mammogram, sometimes there can be a breast MRI, magnetic resonance imaging. It's similar to CT scan. And then there can be a breast biopsy. And after all of this, if a breast biopsy is done, it is cancerous, then your doctor or the oncologist will then stage the breast cancer or stage the tumor and say, okay, it is in stage 1 at the node. Is the lymph node affected or not, and things like that. We use a TNM or TMN staging. I forgot, but it's the TNM staging, I think, yes. Okay, so treatment options that we have: chemotherapy, radiotherapy, mastectomy, and adjuvant therapy. Well, most of the time, they combine all of this together, and that's what you have as adjuvant therapy. And sometimes some people will have to only undergo chemotherapy and radiotherapy. Some people will have to undergo the first 3, and some people will have to undergo just the adjuvant therapy, depending on how advanced the country is or how advanced the disease is. and side effects of the treatment. So for chemotherapy is very harsh on the body. And like Wumi said, she's very correct when she said that when you take chemotherapy, it destroys the cancer cell. However, it destroys the normal cells surrounding the cancer because it cannot identify which cell is a cancer cell, because every cell in your body is growing. It's just that cancer cells grow more aggressively. So it could lead to nausea, vomiting, diarrhea, hair loss, constipation, weight loss, loss of appetite, anemia. Sometimes people experience nerve damage. Sometimes people are so weak, fatigue. Sometimes some people have memory loss. There is a high risk of infection when you're having chemotherapy. There is vaginal dryness. Some people battle infertility as well. Now, the catch here is that everybody responds to treatment differently. Ordinary paracetamol, people respond to it differently. So don't say that if someone is taking chemotherapy, they must have nausea, vomiting, they must have all of the side effects. Some people will have very mild side effects. Some people will have very severe side effects. Likewise, when you talk about radiotherapy, there is lymphedema. So lymphedema means the swelling of the arm. So if it's the right breast that is affected, sometimes, because most of the time radiotherapy is combined with mastectomy or chemotherapy, the lymph nodes there might have been removed. And the lymph node, what it does is it drains fluid from the body to other parts. It connects to other parts of the body that helps drain fluid and remove them from the body. So once those lymph nodes are removed, that means there will be no way for the lymph nodes of the arm to drain fluid, and then the fluid continue to accumulate on the arm like this. So most of the time, if you press, how would I describe your lymph node? If you have like a very mild infection and then you press through under your neck, you feel a very small round circle. If you're healthy, you won't feel it actually. But I'm just trying to say that this is an example of a lymph node. They are located in different parts of the body to drain fluid. Sometimes people have breast pain as a side effect of radiotherapy, skin problems, because it's concentrated X-ray in one part of the body. The skin can get burnt, injured, and things like that. And there'll be changes. Some people feel fatigue. Sometimes because of the proximity of the X-ray to the structures under the chest, like the lungs and the heart, there might be issues with the lungs and the heart. And there could also be changes in the size and shape of the breast. All right. Another part is breast soreness, swelling, infection, bleeding. That's for mastectomy now. So mastectomy is the partial or total removal of the breast tissue. And after the surgery, there can be pain, there can be swelling. The person might have infection if the surgery was not done under an aseptic condition. The person can be bleeding. Lymphedema can also occur. There could be depression. And because women, the breast is a sexual identity for women, they may feel lost. And this is also for someone, it's similar to those who have amputation of the limb, loss of a body part. And sometimes they have body image disturbance, especially if both breasts are taken off or one, and they feel like, how will I look at myself in the mirror? And they feel this sense of loss. Okay, so there are other therapies that people go through, and sometimes people undergo acupuncture. Now, this is called complementary therapy. It is not a therapy in itself that you can take and say it will cure cancer originally. There has been no research evidence to show that these therapies I'm going to mention will natural or will on its own cure you of cancer. So aromatherapy, the inhalation of pleasant smells, pleasant aroma, chiroprathy, that's the setting of the bones and helping to just straighten up the bones, hypnosis, meditation, guided imagery, helping you to imagine good things, and massage, progressive muscle relaxation, just relaxing your muscles and in certain order throughout your body. Music, listening to music helps some people to calm down, relieve their anxiety while they're undergoing treatment. And there's this therapy called Reiki therapy. It's common for Asians though, but here in Canada, it's also becoming more common. And there's spirituality and prayer, and you can hear Wunmi mention almost all the time that she's a daughter of a king. She keeps praying to God and things like that. So your spirituality, your prayer can also be as a form of complementary therapy. Yoga as well, and Tai Chi. And then some people find peace and calm in a support group. And modifying your diet is also very important during treatment. Okay, so I think this is where I'll stop for this one. If you have questions, you can drop it in the chat box or you can ask.
Okay, so there's already a question in the chat box and I happened to drop it. I was saying that looking at the breast that you showed the pictures, I noticed the one that has the orange pale kind of look. Sometimes when you're cold, your skin has to, sometimes you see those pores show, right? So how do you differentiate between the fact, how do you know for sure if this one is the one that is caused by cold, or is it that your breast will always have that texture, that change in texture look, or is just something that comes and goes?
Okay, thank you very much. So I'll say that when there is cold, there is temporality. It's not just your breast that has that pause, your hand, your legs, it's general. But this time it's not happening in your body, and it's a combination of other things too as well. Like I told you, like you see in the picture, the nipple was also very retracted inward. It went inside the skin. Now, what I have seen is that for the cold, the goosebumps that people experience during cold, you'd see that the air on the skin will stand up, and it's like the pores protrude out. But this one, it's like the skin went inward, the O's went inward little by little. But however, you know that this is temporary. It's not only happening in the breast. You can see it all over your skin, all over your hands, your legs, because of the change in weather condition, or because you're reacting to something in your immediate environment. Maybe there is too much ants in one place, and then your body feels like, oh, gory feeling, you understand? So that's how you know that this is just temporal. But once you stand in front of the mirror and you're seeing changes that you've not seen before in your breast only, then it's something to alert you that what's going on here? Maybe I need to check. And if you think that I'm just confused, there's no harm in seeking the service of your healthcare provider.
Okay, and
just better safe than sorry, right?
Yeah, that's what Mrs. Adebenjo will talk to us about. So, but before we move to her, since we haven't gotten any other questions, Cynthia Henacho asked a question. She said, "Can using plastic plates and wraps increase the risk of breast cancer?" I guess she's trying to say breast cancer. She just said cancer.
Okay, so well, research is still ongoing in that area, but most of the time, people research that has been found right now says that these things have carcinogenic content in them, and especially when they are heated up with whatever you put inside of it. Like when you heat, maybe you warm your food in the microwave, the heat is so much, the plastic releases carcinogenic content into the food. Now,
even when they are microwave safe.
So that's where I'm going now. That's why you have microwave safe plastics,
okay,
microwave safe papers, and things like that. But at the same time, I advise people that if you can avoid whether microwave safe or not microwave safe, if you can avoid it, then avoid it totally. If you cannot, then go for the microwave safe, because we know we can't totally trust the producers of microwave safe and non-microwave safe. At least it's like you're entrusting your life into their hands. So if you can do without those things, then do without it all the same. Yeah.
All right. Thank you, Dr. Tola. So we'll just move to the next session now, which is the session 4. We'll talk about support and resources in Canada to deal with, cancer. Somebody had previously asked the question, the role of family and friends in providing emotional and psychological effect and healthy lifestyle choices and life after breast cancer. So, Mrs. Adebenjo, over to you.
Thank you so much for this opportunity. I want to first of all say thank you to the Nigerian community for giving us this platform to be able to share. And thank you also our host, Mr. Ife, for this wonderful opportunity too. And I must say thank you, Dr. Tola, for the great job that you've done in presenting, and also to developing the slide, doing a lot of work underground for us to see, to have a great time. And I must celebrate our Mrs. Dewebi. In fact, you made me to, I don't know, I felt like jumping, like, at the point I was like, hallelujah, I could feel the vibe, I must celebrate you. I celebrate you. Thank you so much for sharing that. I believe that you've been able to encourage some people out there that it's possible. And one of the best things that you shared today, and which everybody can, gain from, is this attitude that I can do it. That fighter spirit. I know that when anybody receives this news, the first thing is, oh, I'm dead. In fact, it's like you have received your death sentence. And I realize that, for you to realize who you are, who I'm a daughter of a king, this thing cannot. And that is the spirit. And for whatever it is, it may not be breast cancer, it may not be anything, but we are just talking about breast cancer today. That's, fighting spirit, that ability to say, no, I'm going to fight. Most times, especially for we Nigerians or we Africans, we die before the death comes. The one thing that really first shocked me when I came to Canada was, I saw myself and my husband were going to a mosque, and we met a woman, and he was smiling at us and said, oh, do you know I have cancer and I have 4 months to live? She was sharing that she has 4 months to live. She was smiling, and that she was telling, I was almost, I don't know, I was really, really feeling. And, we felt like following, we were feeling for her. We were, but she was just, so I felt that I think that's number one thing, that in all this that we are saying, because we don't want us to have fear, that's the first thing to conquer this battle. That inner spirit, that fighter spirit in us, that ability for us to say, no, we can conquer this, and we can really see that in Mrs. Dewebi and with that. So the first thing when you come to Canada, the support and the resources. And I think before I go into Canada fully, one of the things that was profound with what Mrs. Dewebi said was about the support of people around her. She mentioned family, friends, that she can call upon, the one that will come to do this, the one that will come to do that. I think that's the greatest support. When you have this high spirit and also you have this support. So if you have people around you, you have a lot to do. And if yourself also, don't be like, oh, you want to isolate, you don't want to relate with people. You need people around you when this time comes. And resources in Canada. I know that many people, we come to Canada through different means. For people that enters as PR, you automatically have a permanent resident card, and they will give you something we call OE. One of the things that is very good with Canada is the free medical treatment that we receive. And I think that is at least compared to US, Canada has that great help. And if you happen to come as a student, which I came through that pathway. My husband came for his PhD 10 years ago, and we were on insurance. So he did family insurance. So for people that has the insurance from school, you can use that for any treatment that you want to get. But one thing that you should know is that even the way Canada says health is free, there are some treatments that are not free because cancer is very expensive. Because, for example, they may say, oh, go and do this, but they will say, oh, this medication is not covered. Or do this, they will say, oh, that medication, oh, that particular treatment is not covered. So you have to pay out of pocket. So with that, that's why some people that has other jobs, they have this health insurance. They call it extended health insurance. So the OHIP, which is that medical care card, will cover some. And when you want to buy the medication, you bring that one maybe from your place of work. If your husband is doing the job, one of you can just decide, okay, I will cover for my family. I'm talking about people that has the card now. I'm still coming for those that are not having insurance. So those the other insurance will work for that to cover the remaining. But I must say that despite all that, there are some that may still not be covered because maybe they said, okay, I remember I wanted to do one particular treatment and the money is about 600. I have OHIP, is not covered. The extended card, the insurance that my husband has, they said they are going to pay $12 out of 1,600. So what's the point of that? That I'm still going to pay even almost 500 and something. So that's the way it works sometimes, that even if you have insurance and you don't have, sometimes you may still need that support and that financial help, even in getting all this. So to first of all start with, if you're in Canada, we've talked about how you can be doing breast examination, try to check yourself. I was seeing the fight that some doctors are doing presently, that they should extend it, because if you are over 50, you can do free tests for breast cancer screening. If you are 40 below, they are not. But they realize that men, because different ages also have been affected, so even at 40 people, by the time they will do it, it's already stage 3, stage 4, and all that. So there is this fight, and it's still going on. They are yet to approve it, because even if you said, oh, you are feeling something, or you are not sure and all that, you may get to the doctor and the doctor will not send you for mammogram, which is supposed to be free, because it's not part of what the doctor is supposed to send you for, because it will not be covered except you want to pay out of pocket. So that's what many people are fighting for presently, that even if you detect, but in case you detect that, oh, I could see a lump, please go to your family doctor. If you don't have a family doctor, go to walk-in clinic in Canada. Go into any of the walk-in clinic. So by the time they detect it, they will send you for either X-ray, or if they don't want to send you first, but immediately they can establish that there is a lump. After examining it and they can see it, they will send you out for mammogram. So when they send you, they will refer you to a specialist within the. So when you have detected it, try to notify your doctor, or try to go to walk-in clinic if you don't have. I know sometimes it may be hard to get a doctor, even a personal doctor, because we have many people, but few doctors. It may even be a nursing practitioner that can attend to you. So they will, after doing that, they will send you for diagnostic testing. By the time that one comes out, if it happens to be positive, then they will refer you to a specialist. And from there, they will create the treatment plan, like what Dr. Tola have already said. But in the process of this, if you find yourself that, okay, with all this, I don't have, Normally for people that are students, after if you are using the insurance, I don't know, maybe you are using Sun Life, you are using Blue Cross and all that, it should be covered. But after, if you have your postgraduate work permit, you should go to Service Ontario, depending on where you are. I think most of us were in Ontario, to go and get your OHIP. They just changed the law recently and I believe that, I don't know, somebody was shouting me up that they said they can't give it if you don't have job. It's not supposed to be so. Before, as long as you have the postgraduate work permit and you have proof of address that you are living in Ontario, they should be able to give you OHIP. So if you go to one Service Ontario and they refuse you, I will advise you go to another Service Ontario, so that you'll be able to get the OHIP, which at least will give you an opportunity even to get it. I know someone also who took some time, they said, oh, he's not having job offer letter and all that. But after some time, they just gave it. So I don't know, maybe it depends on the person you meet who is still using the previous laws or a new law, I don't know. But I think please just go to another Service Ontario, because some people will have some knowledge. You will call some service you call some customer service, what they will give you, they will have said no. And you go to another one, you get what you want. So please try to do that so that OHIP will still cover some time. I sent it to the group chat that there is, if you know that, okay, they've detected it, and you know that financially with all the treatment plan that have been discussed, you will not be able to afford it. Try to register with Canadian Cancer Society. There are a lot of support systems in Canada, depending on where you are. Just type Canadian Cancer Society that is near you, their offices, or the support programs that is nearby. And when you are admitted, one of the things, I don't know if we have social worker in the house, one of the things that you should do is when you are admitted and you're in the hospital, try to tell them that you want to talk to a social worker. And that's another way to come in Canada. Tell the social worker, oh, I don't have insurance. I don't know how I can do it. And I don't have anywhere to help. Please, I need support. This thing, I don't want it to affect me. I don't want this. The social worker will be the one that will help you to find and to look for all the resources. They will bring it at your table. And that's another opportunity to really use, because especially there are some NGOs that are already partnering with some organizations, like maybe in Grand River, there may be some NGOs that they know, or some people that will have come to them that, oh, if you have somebody that is battling with cancer and they cannot help themselves, they have their own NGO support that. So, but if you don't talk to them, they won't be able to give you that opportunity. They won't be able to give you that, those people that have already put their name on the list, they won't be able to give you that opportunity. You may not even see them on website while searching, but because they have already gone to maybe Grand River, gone to different places, I said, oh, please, if anybody's on admission or if anybody's there, we offer this, we offer that. So the social worker, they know about it. They will give you that opportunity, that chance to be able to, get those opportunities and those the privileges and other support systems. So apart from the medical, there are some groups, there are some support systems, there are some things, for example, people after getting the treatment, maybe they have side effects, they need prostheses to wear, some people have hair loss, they need wig and all that. So we have many people that are saying, oh, our own foundation is just donating free wigs. Our own foundation is just donating this to support this. So apart from maybe the financial implications, the treatment and all that, we have other various, I will send this link to us now also, especially for those who are I mean, that may want to look for, especially in Ontario. If you are in Ontario, I will send the link when I finish talking. I don't want to send it before this time. So try as much as possible to, to negotiate, tell them, you have some people that can really talk to them, get this social worker to talk to, get, when you don't know your rights, sometimes it will be as if, I don't know, you just be suffering in silence. Talk to people, let them know. Even tell your doctor, you may not even know the social worker. Is it possible for me to talk to the social worker? What can I do? I remember when I first came and I had my baby and nobody was here to help. And I was like, oh, I don't know, I'm going to cope and all that. They said, okay, they will link me with the CLSC, they are like the local government, all that. So they sent nurse to be coming to the house to be helping me. Meanwhile, in that process, just because I talked out, they sent, there is an, how will I call it? I think it's an organization, but it's an NGO that they said they want to be helping mothers who are struggling. So, and my husband was a student then, and I have just work permit. So those people, they send them and they will come once in a week or twice, help me to hold the baby, ask me to go and sleep, do that work for me. But if you don't talk out, they won't be able to help you. And that one, I didn't pay them a dime. They will just come every week, help me to take care of the children. You go and sleep so that they will take care of the people. And they are paying them. So we have those supports. I remember while I was in church today, an NGO came to the church to present about the pregnancy, care, a pregnancy center. Immediately, I said, no, I need to send it to Neuro because we have some people that are struggling because they are pregnant. How would they cope? They can benefit from those ones. So they are not government, but they are NGO that render all this support in the society. So please, let's try as much as possible to, to explore all this opportunity that we can have. And please don't suffer in silence. If you can get the community, look at what Mr. Wibi said about how he got the support from people. So that's, that will help and start the treatment. In case if you find any challenge, try to reach out to people who can help. I must say that because there are some things that it depends on what you even if it is your doctor, some of them, they have some links also which they can share with you, even in receiving the treatment. But to cap it all, you need support of family and friends. You need the support of people around you who will tell you. And if you have people around you, please don't let us give them this negativity. Let us be positive. Let us encourage them. Let us share them up. Don't let us say, and all that that will make them to feel more demoralized. So I believe that it is possible. It's a fight that we can win with all these things that we have demonstrated. So I don't know if anybody has question on this before we continue.
So we'll be expecting you to, send in the resources, as you said.
Okay, yes, I will do that.
And somebody has a question. It says, please explain more. I'm currently paying out of pocket and it's quite pricey. I'm sure she was okay. You're muted, Gumi. You want to say something?
Okay, so it's because Cynthia Iheanacho replied my comment where I said they don't cover pre-existing conditions because I came in with my condition. My insurance says they cannot cover it.
Yes.
And my next regimen of treatment is quite expensive. I'm having to do a shot every month. Apart from tamoxifen is manageable, but the shot is the problem now because it's going to run for the next 5 years and it's a lot of money. So I mean, so she now said that generally, but with negotiations and advocacy, we may end up covering pre-existing conditions. So I said, please explain more because I'd like to explore, something that can maybe meet me halfway in terms of cost or everything.
Yeah, Sister Cynthia, she's a barrister, she's a lawyer, so I know she will she may be able to say one or two things. Let me quickly bring out this. For people that are coming in, if you have pre-existing condition, some of them may not take it. But I realized that there are some, as she has said, for example, when my mother-in-law was coming in, before, the first time she came in, they said, oh, they will not treat the pre-existing condition. But the insurance we got when she came recently, we got the one that can treat pre-existing condition. The only thing is, oh, how moderate is it? Is it very, very sick? Oh, no, she was, I mean, okay. But if there's anything, maybe the complication of what happened, like she's well controlled, but anything happened because she's in Canada, then they are covered. I mean, we've been able to cover some of those things when she was here, even despite that. So that's why I agree that if you can negotiate, the only thing is they may have to pay more premium, you know, compared, so which will still be okay. So for people that are traveling in, maybe you should try to negotiate that, okay, so instead of paying maybe $100, you can pay $200 that will be premium, which can still be better than, you know, some of it. And while you are doing this, please reach out to, if you are still paying, reach out to join the Canadian Society. Tell them you need some financial help. You've been paying out of pocket and this is how it's draining you. Is there a way they can help and all that? And some NGOs too. So that one way or the other, if they can see that fighter, they can see how, you know, you've gone, how much you've paid and all that, they know what it entails. Of course, they will, you may be able to, and with the favor of God, you know, you are a daughter of a king, so the king will come true for you.
Amen. Okay, so if we don't have any more questions, I'm sure Cynthia will be able to connect with you, Wumi, after this. I'll find a way to get you guys to connect so you can talk more with her. We're supposed to be finishing in right now, so I want to thank you all for your active participation. I'm sure we learned a thing or two. I, for one, I learned a whole lot. I thought I knew about breast cancer, but I learned some things today. So I want to thank you all for your active participation in raising, you know, awareness about breast cancer. I want to thank especially our speakers, Mrs. Ewebi. I think I tried this time around. I tried to get it from how Dr. Tola and Mr. Adebenjo pronounced it. Thank you so much, Dr. Tola. Thank you so much, Mrs. Adebenjo. Thank you so much for your time. Thank you everyone for coming. This is an hour, 30 minutes of your time. We don't take that for granted. We're just passionate about ensuring that people know about breast cancer. As you saw the statistics, and this awareness is not just for this month. This month is usually commemorates the awareness for breast cancer, but we want it to be an ongoing effort. So you are now ambassadors. You can talk to your friends, your sisters, your husbands. Now we know that it's not just women who are, oh my God, I didn't know my video was off, sorry. Now we know it's not just women who have to deal with, you know, breast cancer alone. We know that it's men, so we can talk to people about it. Let's support one another. Please, you can find support in Nairo. We are here. If you are going through anything, you can personally reach out to me, right? If you feel that the group is too large for you to, you know, handle and talk with someone, you can reach out to me. Let's just stay informed. Let's support one another. And let's make a commitment to continue spreading awareness. So we'll be wrapping up now. The Mrs. Adebenjo is already sending in the chat group the links for people who are interested. Please take them out. You can copy the links and put them somewhere else. And we'd like to thank you once again for coming. It's 5:30. We intended to end this program by 5:30, so we're in time. Thank you so much for your time. And we hope to see you in our future events and our activities. Let's keep the conversation going and let's support one another. Do have a wonderful evening. Thank you so much.
Thank you so much. Bye.
Thank you
Bye.
so much.
Bye.
Yeah.
Bye.